Welcome to the Personality Couch podcast, where we discuss all things personality and clinical practice. I'm your host, Doc Bach, and I'm here with my co-host, Doc Fish. We are both licensed clinical psychologists in private practice, and today starts our new series on schizoid personality. Though least likely to show up in treatment, understanding schizoids is still so important. Many patients that we've seen in clinical practice often have schizoid components to their personality, and schizoid-oriented people often find themselves wondering if they have autism or other neurodivergent diagnoses. As always, this topic is timely and relevant, so let's unpack the DSM criteria, its limitations, and what this misunderstood personality looks like. Let's dive in. All right, Doc Fish, I know that you are a huge advocate for understanding schizoid personality. Why do you think it's so important?
Yes, I think this is a huge can of worms for me. Basically, I have very strong feelings about the misrepresentation of schizoid descriptions in the research. As most researchers and theorists seem to view schizoid personalities like in a deficit-based manner. I don't agree, and I am very disappointed, especially in Milan, since he's usually my favorite. I know.
Oh, man.
I think it's a complete disservice and frankly narcissistic to look at a category of individuals who refuse to be known just out of protection.
Ooh, wow. Okay, there's a lot to unpack here, but tell me, what does it mean that someone refuses to be known out of protection?
Sure. So for the schizoid, they actually don't use a lot of defenses. Their main defense is withdrawal. So this can be physically withdrawing or avoiding situations that involve social components. It could be cognitively withdrawing or engaging in fantasy, basically like not being present. It could also include emotional withdrawal, where they go to their safe cave inside of themselves to hide from overwhelming emotions.
The word skis means split. So these individuals are split from their present surroundings, which is withdrawal, basically. So withdrawing physically, socially, and cognitively. But it's important to note that these personality types are still based in reality. Like, they're just withdrawn into hiding because the world is threatening. So this is not schizophrenia. Like, that's not what we're talking about. We're not talking about the split in schizophrenia. More on that another time.
So if we paint a picture of a schizoid, think about being on a battlefield. You might have the paranoid next to you who has a shield for things to bounce off them and ricochet onto other people.
Okay, so using projection.
Maybe a narcissist in their shiny armor deflecting the violent.
Right, so their self-idealization.
Maybe a sadist with their sword, like tearing other people down before they are destroyed themselves.
Sure, so their defense mechanism is like omnipotent control.
Absolutely. Yeah. The schizoid person doesn't really have anything. So they freeze, they run, they hide, they split off from the world around them.
Right. Okay. So a helpful thing to distinguish with schizoid is that these types are not dangerous. They're just scared. Like, love and life are very threatening to them.
Right. So depending on which theorist we go with, there's kind of two main paths to schizoid development. One is where the infant experiences the mother is inconsistent. So like there, then not there. And then the infant associates love with death, concluding that the need for the mother is what could actually destroy them.
Whoa. Okay.
So there's distance, right? The infant detaches from the mother because the mother is unable to convince the infant that she loves them. So then the infant rejects the dependency and like love needs.
Wow. Okay, this is powerful. There's a lot here. So what you're saying, though, is that this neglect, you're painting a picture of neglect. And that is one of the pathways to schizoid.
The other pathway is where the mother's too overwhelming to a highly sensitive infant, resulting in fears of being consumed or overstimulated by the mother, and therefore its existence could be extinguished. Like if there's no separation from mom, there's no self to exist.
Oh.
So then the infant starts to reject their normal dependency needs and therefore avoids closeness and attachment, and they turn inward to themselves for stimulation.
Oh, okay. This is so interesting. So schizoid development also happens when the child is sensitive and has a more like introverted temperament to begin with. And what you're saying is mom's energy is maybe too much for the sensitive child, or mom doesn't have enough love to properly care for the infant, which is neglect. But then interestingly, there's also a third pathway, which can be kind of a combination of both. So a schizoid child then develops out of this excess or deficiency in attachment, or kind of a combination of those two.
Right. And then all that takes us back to that protection.
Yeah.
The schizoid child turns into an adult that lives inside of themselves, doesn't let the world in. They keep to themselves. They're quiet, kind of like turtles.
Oh.
They just want to be in their shell. And that shell can be very hard. They can actually be really stubborn and not letting other people impinge upon them.
Okay, so firstly, I love turtles. And I also really enjoy schizoid personalities. So there may be a connection there. So with turtles, I always look for them sunning themselves, and I try to approach cautiously without fast movement. But every time my being there, even from yards away, seems to spook them, and they jump right back in the water. Like they don't want me to see them. This is in contrast to the ducks that either just keep swimming or come up to you and they just want fed. But a turtle is so much like a schizoid.
Right. Like imagine being a turtle in an inpatient setting with every provider trying to get inside your shell, and the other patients are like loud and disturbing to you. We're not setting schizoids up to be understood at all. I think maybe we're doing the opposite.
Right. I think the healthcare system just in general is invasive and scary to them, to many really, but especially the schizoid, which is why they don't really seek treatment, because it can be too much.
Now, this brings us to my other gripe with the DSM, that we really describe what's observable and disregard the inner workings because we're not patient enough or safe enough for these personalities to express their true selves. This is the only personality in the DSM that is described in language of what is missing, but not what is actually there.
Oh, right. Okay, so that's not helpful. So we're basically just describing the turtle shell, but not the actual turtle as a whole or what's inside. So essentially, we're just describing the defense mechanisms, but not the core of the personality. And that makes me think that it's basically hard for us to even know that we're working with the schizoid in treatment, because both research and the DSM have not really told us what it is, just what it's not.
Exactly. And the research and portrayal of schizoid personality disorder, it's colorless and frankly empty, which kind of parallels how others view schizoid individuals.
Right. Wow. With this in mind, I know you've spent a lot of time researching schizoid. So how would you describe this personality in a way that is not deficit-based like the DSM?
I really like Nancy McWilliams' perspective on schizoid, highlighting a conflict-based approach instead of the deficit approach. So that conflict is between like wanting closeness, but finding it dangerous, leading to that withdrawal. Schizoids are scared of being overwhelmed, consumed, engulfed, and so they choose distance.
Right. And I think it's important to note that multiple different personalities choose distance or withdrawal, but their core fears are going to be different. Like this is why it's important to talk about what's under that shell, because we have to understand the core drives and fears, not just the shell.
Right. And so the schizoid needs to find the least threatening, lowest energy place to exist in order to survive that overstimulating world.
Absolutely. So how else would you describe the schizoid personality without using deficits?
So we have this highly sensitive individual, and they're shy, overstimulated easily. Some have described schizoids as having thin skin. So they learn that the world is intrusive and dangerous to their existence. Dependency and love are threatening.
Yeah.
They want the closeness, but they're too fearful of it, right? So they choose that distance. They physically withdraw and maybe withdraw into the mind. And this can especially be because they feel emotions so powerfully that they have to push them down and hide. Then what's left for the world to see is just that protective shell that doesn't interact with others or express emotions.
Right. Yes. So they feel emotion so powerfully that they have to suppress them and hide. Like that is key. They don't lack emotions. Instead, they fear being overwhelmed by them because they feel them so deeply. And this right here is what sets schizoid apart from autism.
This is super important. The DSM has one measly sentence saying that schizoid is not autism. So they highlight that the difference between the two is that there's a presence of stereotyped behaviors and interests in autism that's not in the schizoid. I think this is a gross underrepresentation of the differences.
Yeah, there are a lot of differences, but what I like to say about schizoids is that their social hardwiring is intact. Like the circuit can just be tripped easily, so it shuts off to protect itself. But in autism, there's problems with the social hardwiring. Like it's not fully intact. So social relationships can't easily plug in with autism because there's problems with the connections and the wiring.
Yes, I actually love McWilliams' example where she differentiates schizoid with autism. So she states, I have heard autism or Asperger's diagnosed parents say that they had to be taught that their child needs to be hugged. Even if he had trouble getting himself to hug his child, a schizoid father would have no difficulty understanding the child's need.
Love that quote from McWilliams. Yes. So the detection of the cues is not the problem with the schizoid. It's what they do with it versus the individual with autism, even receiving the cue can be a challenge. Yeah. Ooh, okay. So helpful. Thank you, Nancy McWilliams. All right. Back to your definition, Doc Fish. So in your research, your understanding of schizoid is that it's someone who is extremely introverted, shy, and sensitive. So while they long for closeness, it's too scary. So they withdraw from relationships, from society, and into their mind or their fantasies to cope with how overwhelming life is. So then the world sees them as withdrawn loners that are hard to get to know. But again, these types are not threatening. Like they're not going to hurt you any more than a turtle is going to hurt you.
Right.
I mean, unless you stick your hand in its shell, which is stupid. Like, don't do that.
Gosh. Yeah, for real. Now, I did read that some schizoids can apparently like explode if overstimulated enough. So that makes me think, like, have you ever seen a tantruming turtle?
Oh my goodness. I mean, yes, but only if you intruded too much. Like it has to be pretty severe for schizoids to snap. And even then it's like a snap, crackle, pop of a Rice Krispie. Like, but even that is energy that you don't normally see from the schizoid.
Yeah. I mean, seriously, though, their anger or aggression is probably more amusing than threatening. And I really do think that the turtle analogy is perfect. Because, like, have we ever really seen a turtle's belly? Like, have we seen its inner world, at least like without death?
Right.
And I think that's the same for the schizoid.
Yeah, I think so too. One thing that I'll add here from my experience in working with schizoids is that they often have a strong sense of morality, of right and wrong as well, because they see the world for what it is. And then they often appreciate the rules, the structure, and just basic human decency. And I think that speaks to their sensitivity because they care deeply. They may not text you to tell you about their care, but they likely thought about it.
Yeah, I think that's a good thing to add. Schizoids don't usually get knocked off balance in their morality. They can definitely think that like social sways, peer pressure, superficial behaviors are silly.
Yeah.
They can actually be really stubborn in that manner. But I think their morality and sense of self comes from within, and they're not really influenced by external pools.
Right. Yeah. So these types are not going to give in to the latest fad. Like they've likely read about it. I mean, if they've actually popped out their little turtle head to see what's going on in the world, but they're not going to engage. Like they're consistent and they're not wishy-washy like the narcissist who is going to chase after the new fad. And with that, they likely see the disingenuousness of the narcissist and it probably bothers them, but they're not going to act out about it. Like they have a moral backbone, unlike other personalities, which again makes them non-threatening.
Exactly. And it just made me think of like, if the schizoid's able to see all of those flags and the elephant in the room, how are they supposed to react when everybody else isn't?
Yes. It's too overwhelming. Okay, so we have talked all around the DSM definition of schizoid, but let's go there. Let's talk about this disorder level schizoid and what this thoroughly examined turtle shell looks like according to the DSM.
Okay. Personality disorders have to be long lasting. They have to start before adulthood, be present in a lot of different settings. Now, the main patterns in schizoid include detachment from social relationships and restricted range of expression of emotions in interpersonal settings. Then there has to be 4 out of the 7 following criteria.
Okay.
Criterion 1 is not desiring or enjoying close relationships, including being part of a family. Now, the diagnostic features highlight that schizoids appear to lack a desire for intimacy and seem indifferent to opportunities to develop close relationships. They do not seem to experience satisfaction from being part of a group, even family.
Right. Okay. Here we can see that. So the DSM's describing the shell. Doesn't seem, doesn't appear. Part of that shell that they're trying to describe in research and in the DSM is this indifference, sometimes even towards family, or just an overall coldness or flatness towards relationships. But what the DSM doesn't say is that on the inside, they do desire these relationships. They're just overwhelming and schizoids are scared. And at the disorder level, which is where the DSM is sitting, that's what it's describing, like they will hide in that shell even more.
Exactly. Okay. Criterion 2 is that schizoids almost always choose solitary activities due to a preference to spend time by themselves. So the diagnostic features note again that they appear to be isolated or loners. And then interestingly, the diagnostic features also highlight that schizoids tend to prefer like computers or mathematics or any kind of mechanical abstract task.
Yes. Okay. All right. So I think the DSM got part of this right here. So firstly, schizoids do desire to be by themselves rather than with you. Like they're more likely to isolate themselves or be alone. And then secondly, yes, I have definitely seen an interesting connection with STEM interests and schizoid types. And I wonder if this is because computers are much easier to understand than people. Like their problems can be solved through clear mathematical solutions or zeros and ones. And you can sit in front of a computer and tune out the world.
And computers are not going to intrude on you or maybe cross your boundaries or require small talk.
Right.
Just like the schizoid. Sometimes schizoids can really feel like computers or robots. Like they themselves have felt that way.
Yes, absolutely. I have heard multiple schizoid types say that they've been called robotic or computer-like in their response to others. Absolutely.
Okay, now we also have to look at how does their temperament affect functioning at work, especially if there's involvement with others. They may not do well at work, But if they're alone at work, they can actually do much better.
Right. Okay. So again, at the disorder level, which is what the DSM is describing, functioning is going to be impaired across settings. So work may be a challenge, or keeping a job might be a challenge because of the social energy that's required.
Then the DSM also notes that disorder level schizoids can sometimes seem like they have no direction or that their goals drift.
This likely stems from energy expenditure again and overwhelm, because at more severe levels, having goals and steps to reach those goals feels like too much. And it requires too much engagement with the social world, which is scary and threatening. So it's easier just to not.
I have heard from multiple schizoids that everything feels like a priority at all times because all of the data is important. So then to prioritize something is difficult. When you have a million boxes to go through because you don't have as many defenses, like where do you start? You barely have the energy to do one. So then it's overstimulating. They might drift between boxes maybe until they're spent and they go hide and just avoid all the boxes.
Right. Yeah. Like we're saying, like it's all overwhelming. Okay. But there's more that the DSM has to say.
Right. Criterion 3 is not having any or just having a little bit of interest in sexual experiences with others. Now, the associated features note that schizoids usually have few friends, don't often date, and don't often marry because of their lack of social skills and lack of desire for sex.
Lack.
McWilliams, on the other hand, notes that maybe sensual intensity might be reserved for something that cannot elicit enmeshment.
Ooh.
So for example, a schizoid might passionately play his instrument, but demonstrate a, quote, mechanical or detached quality in their lovemaking. Schizoids likely fear the intimacy part of sex because they could be overtaken by that dangerous closeness with that threat of enmeshment.
Yes. Wow. Okay. McWilliams, slam dunk again. Okay. So I'm thinking of some of our greatest musical composers. They were likely schizoids, like their ability to isolate for hours with their craft, not distracted by social happenings or relationships. That likely allowed them to compose some of our most respected pieces of music in history.
I would have to agree with that.
Yeah. But then I'm also thinking of Sherlock Holmes here, who in my mind is kind of the quintessential schizoid. So he passionately pursues solving mysteries and crimes, and he frequently references his kind of mind castle and resorts to fantasy. But this works in his favor and makes him the best at his job. However, he is extremely cold and calculated. Sometimes it seems like he's missing social cues because he just doesn't care. Like he's there to solve the crime, not make friends, right? Yeah. So schizoid types, and then especially disorder level schizoids, which again is what the DSM is talking about, they can have an intense focus on their work that in some ways seems to be a substitute for the passion a relationship of the romantic kind would bring.
And sometimes I think this can get confused with like restricted interest in autism, but it is different.
It is different. Yes. Not the same thing. We're not going to unpack that can of worms. We'll shelf that, bring it back down for another episode. Yep.
Okay. Back to the criteria. Criterion 4 is anhedonia, which means not enjoying experiences or activities that would normally be pleasurable. This can include sex, but like it could also be watching a sunset or walking on the beach or even eating food.
Right. So the DSM is telling us that schizoid types don't react. Like we don't get to see their emotional response to most things that people find pleasurable.
They probably prefer to stay in bed with a book rather than go to Disney. Or just sit in their chair thinking about something really interesting rather than go out and consume the best dessert. So like things that others find pleasurable may just simply not match with what a schizoid finds pleasurable. But even so, you're not really going to see the expression of their pleasure anyway.
Right, right. You bring up some really, really good points here. So, schizoids often prefer the quieter, more reflective and introversive activities to the more extroverted and stimulating ones like Disney World. But then, if they do actually enjoy something, you may not even know it. Like, their affect or their facial expressions may not change either way, like whether they prefer it or not. So they're not going to give you the satisfaction of having that data about them. The turtle says, oh, humans too close. Jump in the water.
Oh my God. No, but for real. That's funny.
Yes, yes. Okay. Keeping it going with criterion 5. So schizoids, according to the DSM, don't have any close friends or confidants except possibly a first-degree relative, so maybe a parent or sibling. And I know how much you hate this criterion, Dogfish.
I really do. Okay, so they don't find people safe. Therefore, they're not really going to have many close attachments at all. Now, immediate family probably has the highest probability of being connected to them. But I hypothesize that if a safe person consistently showed up for them without intrusion, they would eventually come out of their shell.
Yes, I agree. Yeah.
Now, I think it was McWilliams who retold a case involving the provider Frida from Reichman, who sat with a catatonic patient every day, quote, making occasional observations about what was happening on the ward, what the patient's feelings about it might be. After almost a year of these daily meetings, the patient abruptly turned to her and stated that he disagreed with something she had said several months previously.
Several months previously, they'd been stewing. They've been listening. Like, what?
Yes. Well, because they're in there, right? Just because they're not reacting or because you yourself are viewing that, they're not connected, they're still in there. So I hypothesize that without the consistency and the safety, which it really does take immense work for the other person, schizoids just really don't often engage.
Right. And in this case, like the patient felt safe only after a year. Like that's significant, but that's sometimes the patience that is needed to really understand these types. Yeah. And I will also point out that this was an inpatient setting. So this was on the more severe end of schizoid, which we won't get into today, but it's still fascinating and it's still relevant to the conversation because it is the same core under the turtle shell. Like no matter how cracked that shell is or how severe the personality functioning is, it's still a schizoid at the core. And that's what we're talking about.
Right. So going back to just simply describing that shell, criterion 6 is appears indifferent to others' praise, approval, or criticism, not appearing to be bothered at all by what others may think about them. Diagnostic features state schizoids may be oblivious to the subtleties of social scripts and often don't appropriately respond to social cues, which leads others to perceive them as socially inept, superficial, and or self-absorbed.
Oh my goodness. Okay, I'm seeing a pattern here. Firstly, there's so much judgment of how they come across socially. I can also see how this is one of the criterion. So it's unusual, right, to experience someone who comes across as socially indifferent or who doesn't care about social cues. Like our normal human reaction is that, oh, this person maybe is socially inferior or in their head. But I do think it's interesting that our societal judgment of schizoids made it into the DSM. Yes. So how we respond to them is also part of the diagnosis, which makes me think of the training that I went to a while back that said that the drama travels all around the schizoid.
I love that. Oh my gosh, kind of like a turtle in the pond. There's all this stuff going around, but it's just a turtle.
Yeah. Right. The turtle isn't causing the drama. It's all around though. Yeah. So I'm also thinking though, with this definition in the DSM, schizoids don't really have their own space. Others, our judgment comes in to that space, even in the diagnosis. So I'm going, no wonder they don't come out of their shell.
Right. Like how fitting. That is their fear that others will take up all that space and consume them so that they don't exist. And we over-pathologize them. So why would they stick their heads out and show who they really are?
Exactly. Yeah. We've done the very thing that they are afraid of in our diagnosing.
I think this really goes back to the schizoids' ability and necessity to keep themselves separate from others. So others' perspectives, their opinions, approvals, criticism, those are the other persons. They are not the schizoids. There's no connection or enmeshment. So there's not really much stock put into what other people think about them. The schizoid's own self-approval and criticism is what matters to the schizoid.
Yeah. Basically, this criterion here is that they're not going to give you the social data, and thus that comes across as indifferent. But in order to understand why, we really have to take the time and have the patience to understand them.
Exactly. Okay. Criterion 7 is that schizoids show emotional coldness, detachment, or flattened affectivity looking like bland on the outside because others don't really often see their emotional reactions.
Right.
Apparently, they rarely reciprocate social gestures or facial expressions like nods or smiles. Internally, they report rarely having strong emotions like anger and joy, but if they feel comfortable, which apparently is unusual, they might report their emotional pain, particularly pain connected to social interactions. Interestingly, schizoids may especially have difficulty expressing anger, even in response to being directly provoked, which results in others having that impression that they lack emotion.
Okay. All right. So poke the turtle and it's still going to just turtle away in its shell. Yeah. All right. So what I'm hearing from this criterion is that schizoids can detach from their surroundings, becoming more like an objective observer versus an active participant, which can seem like apathy. So this can be due to the emotional overwhelm, though, that's evoked from those experiences. And it could also be that they do feel deeply about these things and they're just not expressing it.
The associated features in the DSM highlight that they underreact or passively react to hard situations and that they can struggle to respond appropriately to important life events. But then I'm like, what does appropriately even mean?
Right. So what I'm guessing the DSM means here is like appropriately, meaning as one would expect in the social world. So for example, maybe like birthdays, celebrations, death, funerals, job loss, those types of things may be met with perceived apathy or detachment on the outside. It's the shell. However, on the inside, schizoids do feel deeply. But again, you just aren't privy to that information.
And because they don't engage in most defenses, they may not always feel the same kinds of emotions that others might feel in those moments. Because they have access to all the emotions and thoughts, none are excluded. And because of all of the emotional intensity paired with that turtly nature, there's not expression of the emotions. They can absolutely look cold or aloof or unaffected on the outside, even though they're probably not.
Yes, right. Yeah.
This makes me think, I think this is fascinating. Research on avoidant attachment dynamics shows that even though a person doesn't react on the outside, their internal biology is elevated. So they measured skin response, heart rate, blood pressure, those kind of things. So it's elevated even more so than anxiously attached persons.
Right, right. So they just detach from strong emotions. And we're not privy to those inner thoughts and feelings unless it's safe to come out and share those things. But I will say too, like at the disorder level, that shell is going to be pretty hard to crack.
Now, the DSM specifically mentions that anger and joy are often lacking. Now, my first thought is like, have you ever seen an angry turtle or a joyful turtle?
I mean, no, but I've seen an angry bear and what seems to be a joyful otter. Like different creatures, different vibes than a turtle.
Exactly. My actual hypothesis about joy, though, specifically, is that it may be experienced as too threatening to express or perhaps even experience because it's likely been taken from them.
Oh.
I wonder if it's a case of like, don't feel joy or excitement so that you don't have to feel any disappointment.
Oh, this makes me think back to attachment. Did mom take up all the space? Like, was her joy of having an infant non-existent? Like in that, what you're saying right there, I'm hearing early attachment in this defense mechanism.
Oh, absolutely. And just the misunderstanding of who they are and the intrusion into their space. Remember how you said that drama happens around the schizoid?
Yeah.
So it makes me think about their birthday, right? Because this is a celebration of their existence. How many times did that one day of yearly celebration become overtaken by maybe a more expressive sibling or parent? Because the schizoid doesn't really take up space.
Because not only does the drama happen around the schizoid, but the expression happens around the schizoid. Other people are doing the expressing for them because the schizoid's experience is internal.
Yep. So then my hypothesis regarding anger is that it can elicit hostility in others. And so why would a turtle provoke a bear or engage in like a weird fight with a beaver? They're going to become overwhelmed. So I disagree that they don't necessarily feel that anger inside. I think they maybe just don't react or they push it down or they detach from it. McWilliams makes a specific note about violent fantasies that a schizoid can have though.
Oh, how interesting. Yes. Okay. So the first thing that you said makes me think that anger begets anger. So schizoids feel anger. Certainly. We all do, no matter our personality type, but we're not going to see a schizoid's anger unless it's safe. And yes, instead of acting out that anger in real life, which is way too threatening, fantasy is going to be a great way to work through it, right? Okay, going back to what you said earlier, though, about like reciprocating facial gestures. I was just thinking, I wonder if this is a power play for the schizoid. Like, I'm not going to give you the satisfaction of knowing my response. I'll keep it to myself. Thank you very much.
That is an interesting thought. It makes sense because no one can then use their emotions against them, which does limit the possibility of being overwhelmed by other people. I was also thinking about like appropriate social cues and how schizoids might find them silly or just not worth their energy. Why would you spend energy nodding back to that person at the gas station that you'll never see again when you are busy maybe thinking about philosophical annihilation or like trying to solve that computer coding problem in your head?
Oh my. Yes. So in other words, like, why would I cast my intellectual pearls before swine?
That's funny. Yes, I think so. But anyway, okay, wrapping up the criteria. Criterion B explicitly notes that schizoid personality disorder does not include psychosis, though it may come before schizophrenia.
Correct. Yeah. So schizoid personality is not the same thing as schizophrenia, but at severe levels, it can disintegrate into a complete split with reality. But that is not the topic for today.
Then also criterion B mentions, we already said this, but it's not autism.
Right. Real quick recap of that. Autism is social hardwiring issues versus schizoids, social emotional circuit gets overloaded, so it shuts down. But it's not an issue with the wiring. So in other words, schizoids receive the social cues and messages just fine. They just probably don't tell you, which can make it hard to distinguish from autism. Save that for another episode, not for today.
Okay, so in sum, the DSM sucks in its definition of schizoid personality disorder because it defines it by what it lacks versus what it actually is. The DSM highlights a lack of desire for attachment and incapacity for emotions, resulting in empty indifference.
Yeah.
Now, in contrast, The psychoanalytic line of thinking depicts schizoid types as feeling deeply, but not partaking of the social trifling that other personalities deem normal. They're turtles with a hard, dull shell that others see, but that shell is filled with fascinating intensity that schizoids like to sit in all by themselves.
I couldn't have said that better. Yeah, well put, Dogfish. All right. And on that note, that's a wrap. Thank you for joining us today on this episode of The Personality Couch. Make sure to check out our blogs that coincide with these episodes at www.personalitycouch.com. And as always, don't forget to give us a thumbs up or rate and review us on your favorite podcast app. And on YouTube, hit that bell so you don't miss a single episode in our Schizoid personality series. Be well, be kind, and we'll see you next time on The Personality Couch. This podcast is for informational purposes only and does not constitute a professional relationship. If you're in need of professional help, please seek out appropriate resources in your area. Information about clinical trends or diagnoses are discussed in broad and universal terms and do not refer to any specific person or case.